Okay guys, I'm going to talk through what we would do here from a pelvic health physical therapy perspective with regards to C-section support and healing. So as we're coming through our early postpartum phases, we really just want to promote healing and restoration of the tissues. So we know through regular tissue healing that it takes at least 6 to 8 weeks, if not sometimes even 12, for just our internal and our external structures to heal. So through a physical therapy perspective, we're just promoting that. We're promoting good body movements, not putting extra stress and strain on the area. And we're just kind of watching to make sure that everything heals up nicely, no infections, no concerns. Once we're to the point of 6 weeks, when things are closing in nicely, our medical providers have provided us with clearance to start to do more things, we're gonna start to expose the scar to some gentle touch. So we're really not gonna get into like scar tissue, like deep tissue movement or scar mobility yet, but we're just gonna start to either I as the therapist or coaching the client to touch around the area, get that area exposed to some different points of contact, so it can be skin on skin. We could also take a washcloth or a t-shirt or tank top as like a barrier and just start to get a little bit of contact through the scarring. So this would be like the earliest amount of contact and movement and exposure to that area of the body around that 6 or 7 week mark, okay? Then as we're approaching 8 weeks, kind of between that 8 to 10 weeks, then we might start to actually get a little bit more assessment and movement of the scar tissue. So if I'm assessing and kind of starting with some basic treatment, I might take 2 or 3 fingers here on the scar, and then I'm just gonna gently press down into the skin tissue a little bit and then move it up and down. So I just started out at her right side here, at the outside portion of the scar tissue, moving up and down, assessing how easy or difficult is that. And then I also can be asking my client, how easy or difficult does that feel? Is that sensitive at all? And it's okay if it's uncomfortable, but it shouldn't be painful. And then I would just kind of move over a little bit, do the same thing, up, down, side to side. And then even as I'm feeling on this patient today, she has a little bit more restriction as I'm pulling up here. There's just more tension, more stretching sensation happening. So I'm gonna kind of take note of that. I might come back to that area later. So I'm just gonna move along the scar, up, down, side to side, and feeling. So from an assessment point of view, as the clinician, I would be taking notes of what areas are moving well, what areas are not moving well or more sensitive. Now, I would also be sending my patient home with this. So this is where if you're watching as a consumer or client, it might be helpful to just kind of reproduce these same motions for yourself at home in this early tissue healing. Again, waiting for that 8 to 10 week mark when things are closed up nicely, healed nicely, you've got clearance from your medical providers, but just starting to add a little bit of contact and movement through here. Okay, so I made my way all the way across the scar, right to left. Now, as the tissue heals, once we get to that 12-week mark, everything's healed up nicely. We really have some free range to assume that the uterus and the deeper level tissues have healed nicely. We can get a little bit more aggressive, okay? So the first couple parts, it's just touching, getting used to that contact. Then it's gentle movement side to side, which is a little downward pressure. And now I'm just gonna be a little bit more aggressive. So I'm actually gonna use 2 hands here personally. I'm gonna push down into the tissue and I'm gonna do the same kind of movement and assessment. Up, down, side to side. Now you also could do circles if you're just trying to promote more mobility here. And don't be afraid, it's okay if you feel things under your fingers. We do have organs underneath. You're not gonna hurt anything as long as you've gotten through that tissue clearing. Everything's healed up nicely. It's okay to feel like things are contacting your fingers underneath the skin surface. Okay, and again, I'm just kind of feeling around where is there tenderness, where is there restriction. So at home, as a client, you could do the same kind of thing. It's also okay to do circles. Just a few suggestions there. I'm using my fingertips. You also could just do kind of like flat fingers or a palm if that feels a little more comfortable. For this client in particular, she's far enough out from her C-section by a couple of years. I feel very confident to go to those deeper layers, deeper levels. Now, some people will ask, is it ever too late to start working on the C-section mobility? And the answer is no. It is easier to kind of create success and breaking up the scar tissue and promoting mobility and healing when we do this early on, kind of right away in that, beginning of the fourth trimester or end of the fourth trimester and moving onward beyond 12 weeks. However, even years afterwards, we can find great success with relieving tension and promoting better function here in the belly. Okay, so that's kind of all the hands-on work from a basic standpoint, moving from the superficial lightest to the deepest treatment. And then the second portion I want to point out is using a silicone cup. So just like you might see people do cupping for their upper back or their shoulders or something like that for improving musculoskeletal conditions, we can actually do some cupping to the low belly in the C-section as well. So the goal is to promote kind of a lifting of the tissue, because when we scar, everything pulls down and in. We overproduce scar tissue and it pulls everything down and inward, which is good for healing but not good for long-term function. So if I use, I really like this brand Lure. They have these like Zen silicone cups that come in different sizes. This is their smaller version. I really like this one for the C-section scar. Again, I can do this as the clinician, but I also can teach my clients to take this home with them and practice at home. So I'm just gonna squeeze the cup together, place it down on her skin, make good contact with that lubricant. I used coconut oil, and then it's just gonna kind of pull her scar and her skin up and in. Does that feel okay? Might feel like a little stretch or pull. And then from there, I can just actually move back and forth. I'm not actually sliding or anything yet. I'm just moving the cup up and down, keeping contact with that same point. That's kind of where I would start. And then I can always option to break the seal. There's a little pink mark for a moment. And then I can move to the next section, do the same thing, move up and down, move around, whatever feels good. Okay, looking for those tight spots, that tension pulling. Now, that would be kind of where I would start with cupping, especially if it's sensitive or they're newly postpartum. If they tolerate this well, we can go to the next level, especially if we have enough coconut oil on there, and I can actually start to glide the cup back and forth or up and down from the scar. Again, the goal is just to create as much mobility, less tension, less sensation of pull or discomfort. Okay, we want those tissues to be able to move and glide on each other. So we have several layers. There's actually 7+ layers of tissue that the surgeon has to cut into to get to baby during a C-section. That's a lot of tissue to heal. That's a lot of scarring that can occur. So through our hands-on techniques and through our cupping, we're trying to get those tissues to roll and glide on each other, both on a superficial level and on a deeper level. So that's kind of my assessment and kind of treatment approach here for addressing C-sections. If you have questions about how to do this, specifically on your body, I always am an advocate for working one-on-one with a practitioner. Schedule a visit, and we can always work those things out together one-on-one.